Okay, so I want to move on to another component of health that I think is really important, which is the body. And specifically, I'm going to talk about the autonomic nervous system, which controls your heart rate, breathing, digestion, so on. And Lonnie did a great job introducing one component of this autonomic nervous system, and that's the sympathetic nervous system or sympathetic branch, which is important for this fight or flight response when you are prepared to face a stressor in your environment. But there's also another system I want to focus a little bit more on in my talk, which is the one I've shown you here on the right, this rest and digest system. And this is called the rest and digest system because it's associated with kind of calm or peaceful or relaxed states in the body. And as I said, this is the part I'm going to focus on today in thinking about Awe's relationship to the body. So the main component of the rest and digest system is a nerve called the vagus nerve. And there's a sort of interesting looking picture to the right of this. I wanted to show you that it comes down from the brain and really travels throughout your body. It innervates your stomach, your larynx, but importantly, your heart, and it slows your heart down. Now, past work has suggested that having a chronic higher vagal activation or activation of this vagus nerve is an important marker for good health outcomes like lower risk of hypertension or coronary cardiac issues, and even potentially faster recovery from surgery. So this is something that, if we can cultivate this elevated activity in this vagus nerve is something that we would want to do. And so in one study, we wanted to look at Awe's relationship to this specific element of the parasympathetic nervous system. And so we had our undergraduates like Lonnie's come in and they were connected to physiological measures, which you can see pictured here. And then we had them watch an awe-inspiring video. We chose to focus on one where people saw Earth and then zoomed out into space. And throughout this whole time, we measured a non-invasive index of their vagal nerve activation. And in our study, what we found was that inducing awe was associated with increased vagal activation. And I do want to mention that these findings are, one of many people have looked at, virtual reality environments, which are really interesting and find these effects, but they don't always find them. So it's something we need to study more to find out overall where the boundaries of this effect are. For us, we find that it does relate to how positive people's awe experiences are. So I told you we had a video of awe or a video of space rather, and zooming out. Some people found this awe-inspiring and really exciting, and they felt, how amazing this is to be part of this large, vast space. Other people felt awe, but they also felt a little bit fearful and maybe insignificant as this little pale blue dot in vast space. And what we found is that the more people had these sort of positive experiences with awe, the better it was for their vagal functioning. So that may be a really important element, is really leaning into those positive awe experiences for your health. And so there's, a lot of really interesting work in this area. And I think we should pursue the question of whether awe can promote better cardiac health and thereby influence how your body is functioning.